And if you don't know me, I'm Caitlin O'Connor. I am one of our recent adds to the board of directors, and I had a hemispherectomy in 2015. And I get the honor of introducing Dr. Brynn Huyssen today. And here, I have my little script. Dr. Huyssen is a clinical psychologist specializing in the assessment and treatment of post-traumatic stress. She has over 15 years of experience providing evidence-based treatments for trauma to adults and adolescents in hospitals and outpatient clinics. Dr. Huyssen has traveled extensively to train doctors and nurses around the world on how to support patients following trauma and exposure to grief, and how to promote resilience. She also serves as a consultant to organizations that are working to become more trauma-informed. And welcome, Dr. Huyssen.
Thank you, Caitlin. I'm Dr. Brynn Huyssen. I'm a clinical psychologist with over 15 years of experience working with trauma and trauma-informed care in a variety of settings. I've done therapy with women and adolescent girls working to reclaim their lives after childhoods defined by physical and sexual abuse. I've worked with active duty military members and veterans who are back home after multiple deployments, just trying to be home with their families and function after all the horrific things they've seen in war. I've provided crisis intervention to young adults serving abroad, volunteering for the U.S. after they've experienced and witnessed horrific things. And I've developed trainings on trauma that have been used to teach medical providers and first-line responders around the world. I've even delivered the devastating and unexpected news to parents that their son or daughter has passed away. So I thought I had seen it all. But until 2016, I had not seen epilepsy or brain surgery. About 8 years ago, I experienced a very unexpected collision of my professional and personal life when my son was diagnosed with catastrophic epilepsy at 4 months old. He spent the first 2 years of his life in and out of hospitals as we struggled to gain control of seizures, figure out what was causing them, and manage several medication side effects that led to multiple extended ICU stays. We're very grateful that he was a surgery candidate. He had his first surgery in 2017, and again when the seizures returned in 2020. And he's been seizure-free since then. I've heard parents of medically complex kids talk about their life in two distinct parts: life before the diagnosis and life after. In my before, I worked with trauma and grief professionally every day. But as we quickly moved into my after, I became so accustomed to hospital admissions and seizure monitoring and everything that goes along with that. I really developed a particular interest in medical trauma, what it was, how to prevent it, and how to treat it, as my own family was living it. I can still remember the pattern on the neurology fellow's tie who treated my son during his first admission that we thought would be his last. Turns out we got to know him and his many bow ties very well. I remember when our favorite nurse came in the room to bring a care package to us, filled with snacks, books, toys, and a homemade blanket dropped off from a local organization. When she came in the room, I thought, she must have the wrong room. We're not that family. But we were. We knew all the best rooms on the neurology unit that had the most beautiful view of the sunrise over the monuments. We lived in Washington, D.C. at the time. And we knew where to find the best coffee in the whole hospital. And it wasn't where you would think. I could go on and on. We don't talk about the trauma of what we and our children have been through enough. There's a multitude of resources out there on caregiver stress, the importance of self-care, caregiver burnout, which is all great and helpful, but it doesn't quite capture what epilepsy families experience and continue to go through on a regular basis. You might need more than a walk every morning and a couple deep breaths, and that's what we're going to talk about today. Before we begin, I do want to say that this is a hard topic. If you yourself have had epilepsy surgery, or you're a parent in this room whose child has, you have already done hard, but to sit here and listen and reflect on what we're going to talk about, it could bring up a lot of thoughts and feelings and memories, which could be a different kind of hard. So please feel free to step out if you need a break anytime during this presentation. So today we're going to define pediatric medical traumatic stress, recognize common and persistent stress reactions that occur in both adults and children, understand the risk factors and the role of healthcare providers and settings, and learn strategies to help yourself and your child. So what is a traumatic event? There are many different types. They're all listed here. When we talk about our community, our pediatric epilepsy surgery community, through the traumatic event lens, we're talking about a serious accident, illness, or medical procedure. That standard definition, though, doesn't quite capture what we've experienced. Epilepsy isn't a single medical event with a clear path forward and clear healing. Our kids don't hit rock bottom and then bounce up. It's an ongoing process when you're living with seizures and you're existing in an unpredictable world, constantly in crisis mode, and you don't know what's next. If you're a parent in this room, you've likely made or are considering making probably what is one of the most hardest decisions you can make as a parent. The path after surgery is unpredictable, and we don't know what to expect. The Pediatric Epilepsy Surgery Alliance has created a wonderful global registry, thanks to Monica Jones, that helps ask questions to the community to get a sense of what life looks like after surgery. And that's wonderful and collects good information and data. But everyone is different, and the path forward looks a little bit different for everybody. Every case is different, and so it continues with follow-up appointments and long-term care planning and IEP meetings, which should probably be up there as its own category itself. It's all re-traumatizing. So yes, there's a serious medical event and a medical procedure, but there's also ongoing exposure to everything that comes after. I'm going to talk a little bit about the different types of traumatic stress, but for the purpose of this presentation, I'm going to try to use the umbrella term of traumatic stress to capture them all going forward. So, pediatric medical traumatic stress is a relatively recent term that describes the reactions of families, so parents and children, that they experience following pain, serious illness, a medical procedure, or invasive treatment experience. Up to 80% of parents and children experience some sort of traumatic stress reaction following one of those. The next one is a persistent stress reaction. Around 30% of parents and 25% of children experience this. This is when those stress reactions stick around, they don't go away, and they start to impact you. And they can develop into what probably is a more familiar term for you all, post-traumatic stress disorder, or PTSD. And those percentages, 30% of parents, 25% of kids, are likely higher with our population because of all the unique characteristics of epilepsy and epilepsy surgery that I spoke about. It's not a clear medical event and a healing path forward. It's ongoing exposure to everything that comes after. So what are traumatic stress reactions? So the traumatic event is what happens, and then the trauma, or the traumatic stress reaction, is how you feel afterwards. There are many. I'm not going to read through them all, but I'll touch on a few. So thinking a lot about the illness or procedure is common. It's our brain's way of trying to make sense of what's happened. In kids, this can look a lot like constantly asking questions endlessly. Everyone knows what nightmares are. Flashbacks are feeling like you're right back there, reliving the event. Feeling irritable or angry. We see this a lot in kids. Kids can have difficulty with emotional regulation, so controlling and expressing how they're feeling. Hypervigilance is feeling constantly on guard. When my son was in the season of his many admissions, one of the hardest things for him were IV draws. He was tiny, and so are his veins. So this might be a familiar scene for many of you. The IV team comes in, tries to find a vein, has difficulty, screaming child, blood everywhere, parent trying to hold them down to help. This played out enough times that he would just sit in his crib, staring at the door on guard for the IV team to come in. And even if he turned his head away and someone walked in the door, he'd whip it back looking to see if it was someone he recognized. So that's a good example of hypervigilance. We see physical or somatic complaints in kids a lot. So this might be nausea, headache, vomiting, unrelated to the medical condition. And that's a fun game, right? Is it a shunt failure, a medical illness, traumatic stress? Anyone's guess. New fears related to the event are common, not wanting to go back to appointments, return to the hospital. Change in appetite can happen a lot. Isolating at home or at school, or actually school refusal, we see a lot in kids. And their refusal to go to school really has nothing to do with not liking school or feeling unsafe at school. It has to do with them asserting a sense of control. So many of these reactions are normal initially. In the trauma world, we say that these are normal reactions to an abnormal event. And I can't stress that enough. Everything is normal when we're reacting to a traumatic event, especially immediately in the days after, weeks and months following. And for many parents and children, these traumatic stress reactions improve over time and completely go away. But that actually becomes less likely when you're living with chronic medical trauma, like a lot of us are. Wondering when the seizures will return, when a shunt will fail, going to multiple follow-ups, procedures like MRIs, IEP meetings. It's essentially like being re-traumatized. And again, when these reactions stay and stick around and start to impact us, it can turn into post-traumatic stress disorder. Take a moment to look at this list up here. How many of you recognize some of these either in yourself or your child now or before? Okay, a lot of hands. So they're completely different for everyone. That's another point I want to stress. And even different in families and among spouses. I've heard a lot of frustration from parents whose husband and wife has experienced the same exact event that they have, but are having a completely different response. Two people can experience the exact same event, but have a different reaction. My wonderful husband who's here won't mind me sharing that we have very different reactions to traumatic stress. The difficulty sleeping one up there, that's me. When we're in the thick of it, I'm awake, mind racing, can't sleep. My husband, on the other hand, never slept better. He sleeps deeply and often, which is terrific, but it's also the way that traumatic stress presents for him. Our trauma memories are encoded differently than other memories. So when people ask, how can two people experience the same event but have such a different reaction? Well, it's because everyone's brain is different. And we see this especially in kids. Kids' traumatic stress reactions is actually based more on their subjective experience of the event. So what they think about it, how they feel about it, much more so than anything objective, like what happened, how severe it was, how long it lasted. There are some risk factors that do impact the development of traumatic stress. For adults, it can be impacted by your coping style. Do you have a mental health history or a trauma history? If so, you might experience more traumatic stress. Your level of engagement and exposure with what's going on. Are you the parent that's going to all the appointments, coordinating the care, staying over in the hospital, physically restraining your child if that's something that you have to do in your home? Are you directly and regularly exposed? Do you have a positive support system? If you have other stressors going on at the same time, that can also experience your level of traumatic stress. For kids, it can be age. Actually, when kids are a little bit older and they're able to understand and process things, they're at greater risk of developing traumatic stress reactions. Separation from parents for prolonged periods of time. If they went through periods of severe pain, being repeatedly exposed to scary sights and sounds, MRI sounds are a big one for our kids. Were they given the options to choose things? Did they feel in control? This is huge and can actually be really helpful to use Child Life for this. Child Life is excellent and, in my opinion, a pretty underutilized resource. Child Life completely cured one of my kids from being afraid of the mask for anesthesia just by giving him the option to pick out stickers to decorate it with. Are your kids socially connected? Do they have friends? Research has shown that the development of traumatic stress is also very much influenced by the healthcare provider and healthcare setting, and that healthcare providers can actually hurt or heal. There was an excellent study that came out of Alberta Children's Hospital that actually looked at the role healthcare providers play in mitigating traumatic stress in parents of medically complex kids. Exactly how news is delivered to families is a significant factor, and a lot of medical schools don't even offer formal training on this, which leaves students and residents to just observe whomever they're able. I always think it's ironic when I'm asked to give a training to medical professionals, and something that they request is, help us learn how to talk about hard things, or delivering difficult news. Difficult news is when your Ticketmaster cart freezes when you're trying to buy Taylor Swift tickets. Difficult news is not learning that your child has a big medical diagnosis. That is devastating and life-changing news. We need to call it what it is, train widely on it, and that starts with the healthcare provider. I remember when my son was first diagnosed and a team of 18 doctors, nurses, whomever else, crowded into our hospital room, delivered this devastating diagnosis, said they would be back, and left. They came back 2 hours later to answer our questions, which left my husband and I sitting there waiting with this news dumped in our lap. Nothing else to do but turn to Dr. Google. I'm sure many of you have been there. Studies have shown that the way terrible medical news is delivered and how supported the person feels in those initial moments can actually determine whether or not they develop traumatic stress reactions and how severe they can be. There needs to be time to process and ask questions. Parents should be treated as the expert on their child and involved as part of the treatment team. Concerns need to be validated and taken seriously. And providers should have the skills to ask and briefly screen for distress and be proactive about connecting parents, patients, siblings to support and care. I don't think it was till our 11th or 12th admission did someone mention to us as a doorknob comment as they were on the way out, hey, do you want to talk to social work? It was a while till we heard those words. Healthcare systems also play a really important role in the development and prevention of traumatic stress. Healthcare systems need to be trauma-informed. That's a big buzzword. It means that all staff are trained regularly, not just at orientation, on traumatic stress. So everyone from the hospital president all the way to the coffee shop cashier has a solid understanding of what traumatic stress is and their potential role that they play in preventing it or increasing it with all the people they might interact with in the hospital over the course of a day. It means that they know the language to use. It means that they know how to give kids option and choice whenever possible. The importance of keeping kids with their caregiver and the pain management protocols that are in place, and everything else that you can do to prevent re-traumatization for families. Being trauma-informed for healthcare systems also means having a solid system in place to alleviate the burden placed on families for coordinating care across departments or disciplines. Has anyone ever had their head spinning with all the appointments we have to coordinate and remember? You call one office to make an appointment or put on hold for 10 minutes, only to be transferred to another department, put on hold again, and that's if you didn't get disconnected along the way. They finally pick up and say, oh wait, you need to call a completely different number. So now 25 minutes of your life is gone that you're never getting back, and the appointment still isn't scheduled. And don't even get me started on navigating healthcare insurance. That's a whole other different animal. Family opinion and preference need to be taken into account when hospitals write and revise policies. There should be a solid screening, support, and referral process that is well structured and well known when referring families, patients, and siblings to get counseling or support. And I want to highlight that it should be a process. It's not a, hi, here's some resources, good luck. It's an ongoing process where your hand is held throughout it all until you get the support you need, whatever that may be. So what does being trauma-informed look like in practice? I'm going to share an example of what it doesn't look like. Recently, I had a dear friend take her son for his first MRI without sedation. She did a wonderful job preparing him. He was ready. And he even spoke to my son the night before to know exactly what to expect about the procedure. She took the day off of work. They drove pretty far. But when they got there, the MRI tech they had was certainly not trauma-informed. He told the child that it was going to be hard, that he couldn't cry, and that he wasn't sure that he could do it, which elicited, of course, a certain response from that child. And then he told the parent that they shouldn't have tried without sedation, that he didn't know why they were there, and even gave her unsolicited parenting advice. They left and went home. Imagine how different that interaction would have gone if that MRI tech was trauma-informed. If he approached the situation with care, compassion, understanding, gave the child an opportunity to ask questions and have them answered, all through the lens of truly understanding what the family had been through and continues to endure. So now we're going to talk a little bit about how to help yourself and your child. As parents, we need to know how to manage our traumatic stress reactions. This is so important because if we're experiencing traumatic stress that's impacting us, we probably can't be the caregiver we want to be. We probably also can't be the spouse, the employee, or the friend we want to be either. Know your triggers. Know what brings you to your knees. It's very important, and again, completely different for everybody. MRI sounds really do it for me. They bring me right back. I've stood in more of those with both my boys than I care to remember. Another one that I'll share that's a little less common, when you go around the room during IEP meetings and you say your name and your role, I can hardly get out my name and that I'm mom. My husband looks at me like I'm nuts. He's like, are you kidding me? After all we've been through, this is what does it? It's something about all those people being in the room, crowded in there, helping my son. It's powerful. And if I put my psychologist hat on, probably a little bit too similar to diagnosis day, all those people in the hospital room, and brings me right back. It's re-traumatizing. Work through your avoidance. This one is really important. When we experience traumatic events, we're going to be inclined to want to avoid thoughts, feelings, situations that remind us of them. But it's so important that you push through these things because avoiding them only makes their trauma power stronger. You want to train your brain that they're safe and you don't have to avoid them. If a child gets bit by a dog and develops a fear of dogs, you don't want to keep that child away from dogs. You want to slowly work them back up to being comfortable being around dogs. That might look like giving them a dog stuffed animal, watching videos of dogs, waving at a dog across the street, and eventually working their way up to petting a dog again. That way they learn not to avoid it. They work through that avoidance. Same thing with traumatic stress reactions when we're talking about medical trauma. Prioritize self-care. It's so important and so easily lost in the shuffle when we're caring for our medically complex kids. There are two levels of self-care, routine and microdosing. Routine means deciding that you're going to do something regularly and sticking to it. So You're going to go for a walk every morning after breakfast, or you're going to go to that exercise class every Tuesday. Microdosing is a new term I heard recently that I absolutely love. It means finding little bits of self-care time when you can. So you find yourself with 10 minutes, pick up the magazine that's been on the coffee table you've been meaning to read, or take a hot bath. Find social support. This one's important. You're all here at this conference, so that's great. The power of being connected to other people who get it and who have been through similar experiences cannot be underestimating. It's powerful and it's healing. There are lots of active coping strategies you can do at home. Relaxation techniques reduce traumatic stress and anxiety. They've also been shown to improve sleep. There's so many different kinds. There's deep breathing exercises, progressive relaxation, guided meditations. You can attend a class in person or online. There's lots of apps you can download. I'll go through all of those in a moment. Positive self-talk is exactly what it sounds like. It's using positive, motivating, affirming language with yourself. It might seem silly to look in the mirror every morning and say, I'm strong, I can do this. But research has shown that positive self-talk actually improves attitude and can reduce your traumatic stress reactions. We have a sign in our house that says, we can do hard things. And we read it with our kids before we go out the door to a swim meet or to the first day of school. And I've caught them actually telling it to each other and reading it themselves. Habits trickle down. Your kids will model what you do. Mindfulness is being fully present in the moment with your thoughts and feelings completely without judgment. You can do this with mindful breathing, body scans, mindful walking, mindful eating. By connecting to the present moment, the idea is that you can reach a calm inside, even when outside is a complete hurricane. So find what works best for you and incorporate these things into your daily routine if you can. The last one is engage in evidence-based therapies. I'll talk more about that in a moment. So how to help your child. Be aware of your child's triggers and what the typical triggers are for medically complex kids. So being left alone at the hospital, experiencing severe and ongoing pain, being exposed to medical equipment that might be new or scary, seeing other sick or hurt kids, going places they don't want to go, revisiting the hospital, doctor's offices. So know what triggers your child and watch for all the signs we talked about. Explain everything in a way that they can understand. This goes for siblings too, and this one is critical, especially before an appointment or procedure. Explain exactly what will happen so they have no questions and they know exactly what to expect. Then explain it again. Feeling like they know what to expect instills a sense of control in a situation where they likely have very little. If Child Life is available at your hospital or clinic, use them. They're excellent at doing this. They're such an underused resource. I think I already said that. Children might need help labeling their feelings. This can be successful in younger kids with coloring or drawing. Validate their fears and reassure them. This could look something like, it sounds like you're feeling scared about your upcoming medical appointment. It's okay to feel scared. I'll be there with you the entire time. Let's talk about all the steps that will happen once we get there so you know exactly what to expect. Siblings will have thoughts and feelings that need validation and reassurance as well. Maintain routine and keep normal limits. As parents, we might find ourselves having looser and more relaxed boundaries with our medically complex kids. I've had parents say they realized that they were treating their medically complex kiddos differently without even needing to. We have to be careful of doing that in our house for sure. But this is important because kids do well with routine. They do well with boundaries. They do well with structure and knowing what to expect. Again, true for siblings as well. Yeah. Giving control and choice where you can is paramount, even over little things, because so much is not going to be in your kid's control. Would you like to do your blood pressure first? or your temperature. That's a great trauma-informed approach that healthcare settings can use. There's this one building we go to where we live in Virginia for most of my son's appointments. And when we go there, he knows that he doesn't have much control over who we'll see, what he'll be asked to do, how long we'll have to wait. But there's a really tall parking garage with a glass elevator that goes all the way down to the first floor. And he loves riding this elevator down. So every time we go there, even if it takes extra time and we're a little late, I let him choose what floor of the parking garage we park on. He loves it. And it's a way of instilling just a little bit control and choice at the beginning of an experience where he'll probably have very little. Relaxation and mindfulness can be great for kids too. Incorporate these into your child and family's routine. I'll share a couple apps that you can download that might be helpful. And seek support for your child. There may be support groups for older kids especially, so they can connect with kids who've had similar medical experiences. It's one of the benefits of living in the technological age we do. You can connect with kids all over the world. Pediatric Epilepsy Surgery Alliance Conference here does a great job with sibling and peer programming. Take advantage of that. We can talk a little bit more about formal support now. If you feel comfortable sharing, how many of you have been to therapy, you or your child, to work through specific issues related to medical trauma? Good, okay, good. Therapy is a fantastic idea. I know I'm biased, but it is. One of the most often questions I get from parents in our community is, how do I find a good therapist? What type of therapy should I try? Psychology Today is an organization. They used to put out a magazine. They have a website with all different blog posts by mental health providers. They have great resources. But what they're most well known for is an online directory that lists therapists that are taking new patients. So you can search by zip code, gender, type of insurance they accept, and type of therapy they practice. I really recommend you see a therapist that specializes in evidence-based therapies. It's also known as evidence-based practices. This is a set of therapies that has robust research behind them. They've been shown to help treat traumatic stress. They're usually shorter term, about 12 sessions. They're focused specifically on the trauma. You might have homework to practice at home between sessions, and they also track your symptoms along the way so you can actually see yourself improving and see yourself getting better. Therapy where you just talk is helpful, but talking about your relationship with your mother or a pivotal moment from 6th grade is not going to do it when we're talking about traumatic stress. The best way to treat traumatic stress is to do an evidence-based therapy with a licensed and trained provider. I've done these therapies with Vietnam veterans who've had debilitating PTSD for decades. And just a couple weeks into one of these, they start experiencing their symptoms decrease for the first time. The power of these therapies is really remarkable when done correctly. I encourage you to check them out. Think of all your memories in a big filing cabinet in your brain. They're all up there. If I asked you what you had for breakfast this morning, you would pull that file and be able to say an answer. If I asked you what you did to celebrate your last birthday, you would do the same thing. Pull the file, open it, give an answer. But our trauma memories are encoded differently. The file is shaped differently. So it doesn't fit in the filing cabinet of our brain. They're in there, and we're trying to stuff the filing cabinet closed, but it's not working. And when you have your trauma files sticking out, when they don't file away, that's when you see all the traumatic stress reactions and potential PTSD that we talked about. So engaging in an evidence-based therapy is how you can make that file fit. You process through your trauma memories in a way that re-encodes them, so you can file them away with the rest of your memories and finally close the cabinet. I put on here a couple examples of typical evidence-based therapies you might see therapists in your area practicing. Cognitive processing therapy, also known as CPT, helps you focus on the thoughts you're having about the traumatic event And when you change your thoughts, you change your feelings. Prolonged exposure, also known as PE, helps you gradually confront the things you're avoiding related to the event. Eye movement desensitization and reprocessing, also known as EMDR, helps you process through the traumatic event while focusing on a repetitive movement, usually a finger, back and forth in front of your eyes. The idea is that when you're focusing on something repetitive visually, it helps you re-encode the memory so that file actually fits nicely in the cabinet again. Play therapy is great for younger kids. A skilled play therapist can really heal through play therapy, and kids get to express themselves in a medium that they feel most natural and comfortable in. Trauma-focused cognitive behavioral therapy, or TFCBT, is good for older kids and adolescents. A therapist works with them to examine the thoughts they're having about what they experienced and the connection between thoughts and feelings. So when you're searching for a therapist, it's really important to ask, have you treated medical trauma before? Do you work with this? And do you practice evidence-based therapies? So here's a couple resources that I referenced earlier. Apps are up there. So Calm is really great for kids. It's an app with a lot of relaxation exercises, guided meditations. Headspace I tend to prefer a little bit more for adults. Smiling Mind is a great one. It focuses on mindfulness, so being really present with your thoughts and feelings. Clarity is another one for kids. It helps kids understand the connection between what they went through and the anxious or trauma thoughts that they're having. Positive Penguins helps kids understand the link, the connection between their thoughts and feelings. And Emotional ABCs is great for helping identify and label feelings, especially for maybe like more difficult emotions in kids, so irritability, anger, frustration. Up here is just a couple books. Some are for adults, some are for kids. I have a handout. It may be on some of the chairs, I think, and I'll post it online, that gives so many more resources. I just grabbed my favorite up here for the slide. So a few final thoughts. It's completely normal and expected to experience traumatic stress reactions, especially given everything that we've been through as epilepsy and brain surgery families. Traumatic stress reactions look completely differently for everyone. It's a normal reaction to an abnormal event, and no two people react to the same way. And then there are so many ways to help yourself and your child. The first half of the battle really is being aware of what traumatic stress is and how it might be impacting you or your child. And then it's about taking care of yourself, finding social support, committing to practicing effective and healthy coping skills, committing to good therapy. So we're all part of a club we never thought we'd be in, but I'm so thrilled to be up here sharing with all of you what I've learned professionally from my career and personal tidbits as well. So I hope there's something in here that you can take with you on your own journey. Any questions?
Can you spend a little time talking about how you help with the trauma that's ongoing? You may mention it's not one specific event that you face trauma. My daughter, who's a sibling, is trying to get therapy, and some of the things I hear is, but Mom, it's not just one thing we're going to treat, it happens all the time. And so can you just kind of talk about like how do you find the right therapy, or what, like, you know, I'm familiar with EMDR. How do you do those types of therapies for not just a specific event, but because it's kind of a lifelong condition?
Yeah, great question. So when we're talking about therapies, one of the most pivotal things, especially for kids and adolescents, is that you connect with a therapist that you feel like you can trust, that you have a really good connection with. And not all therapists are going to be a good fit for everybody, so you might have to shop around a little bit and find someone that you feel really comfortable with. That's the first part. The second part is, some of these therapies ask you to select a couple trauma memories to really focus on and work through, but what the research has shown is when you do that, the benefit generalizes. So just because you're thinking about a specific event and you might be talking about it in depth, that doesn't mean that it's not going to help the other things that you might not be directly talking about, the other trauma memories, the other trauma experiences. So it can generalize. The next thing I would say outside of therapy, for kids especially, and I mentioned this, but connecting with peers, having good, effective coping skills. Some of those apps on there, especially Clarity, can be really good for older kids and adolescents. So even outside of the therapy room, they're doing work on their own. They're working through it outside of that 45 minutes a week. So it's kind of ongoing, and it's like a muscle. So the more that you use it and practice it, the relaxation or the challenging your trauma thoughts, it'll become easier and more like second nature to you.
I just wanted to share when you said you had 18 people come into the room and that's how you found out. One of my memories, I had the trauma informed thing where the doctor on call, he by himself came into the room and he asked me to sit down next to him and he said, like, what is your understanding of why you're here? And he was like, your daughter had 25 seizures in this hour that she's been here. And he was talking to me one-on-one while there was a cart coming in and they were administering emergency meds. But it was like, I still remember like he's in that chair right now, and it made the world of difference of how it was like one guy in the room and it wasn't this whole thing. And so I can appreciate how like those memories are just like coded in your brain.
Yeah. What hospital were you at? Can I ask?
So we were at Texas Children's.
That's great.
Hospital in Houston.
So clearly they've had training on the best way to deliver news, sitting next to a patient, good eye contact, calm voice, right? You don't overwhelm the room with a ton of people. I'm sure you were given the opportunity to ask questions.
Oh yeah. And now that I've been to the hospital a lot of times, I know the doctor on call doesn't usually come in your room and sit next to you.
Right. Thanks for sharing that. That's good. Go ahead.
Do you see the medical field changing to just an article of epilepsy where we have more embedded approaches to mental health? My daughter had a fracture of infection at 8, started having seizures at 12. We had surgery at 14, and last year started having PMS seizures and got diagnosed officially with PTSD and separation anxiety. And I went in for 48 ECG and the school nurse and the school therapist and getting through this, but at the end of my visit, I got handed and I took 66 pages of psychologist to go find my own therapist. And when is that going to change, right? Because there's so much that we're dealing with. That alone is a trigger. Right? I really read back and I can do this. I can do this. I'm going to start calling them through. So looking at the website, and I said, this is totally insane. And I went another method, and I advocated with the support that I had. So I went back to school, and then two social workers who immediately sent me 2 links to resources into this conference. I would be here today if I didn't do that. And I've learned so much. But do you think that's changing? Because my email to the hospital was that if I need to get a cardiologist, I got a referral. If I need to get a neurologist, I got a referral. I need to mental health referral, I got 66 pages to go help myself. Do you see that changing? Or that's just it's insanity, and we're all dealing with that.
I think that's a great example of how mental health and medical are still not, there's still not parity there. So it depends on the hospital. I think if you get a really good hospital lead and a really good head of social work who values this, you can see change pretty quickly, but it has to be a priority. And we're still not even seeing it come up in the medical school curriculum yet, having that, talking about mental health, understanding mental health, understanding how to deliver difficult news, right? But when we're talking about hospital level, it really has to come top down, and you have to have people that are invested in changing a culture that has been ingrained for a very, very long time. Ingrained in the doctors and physicians working there who went to medical school a long, long time ago for a lot of them, right? And this is how they were trained, and mental health was kind of like a secondary afterthought. So hopefully, it is slowly changing. Psychologists are being included more on medical teams, things like that. There was no psychologist in the room when we got my son's diagnosis, but from what I understand, they do that now. They bring a psychologist or social worker in the room. So I think it is slowly changing, but it takes time. Go ahead.
I just want to offer myself as a resource to folks. I'm from Toronto, so it's more Canadian focused, but I'm a child being counselor first and also trained to be a psychotherapist and have a clear understanding of medical trauma as a caregiver and also as a professional. So if anyone wants help or wants to collaborate on creating a system like that for triage, I'm in that world doing that work as part of the mental health strategy. We're trying to do exactly what you just said. So have to be connected and support, but also not aware of the states as much.
So I have a suggestion to help parents work through their avoidance. Start organizing wine testing, station,
Social.
at the hospital,
Yes.
so get used to going, not just to hear bad news like that.
Yeah. Go ahead, sorry.
You talked about the incident about trauma informed. I'm just curious what tips you have because I am very vocal and I kind of want to make children talk to like that. So I typically, what would you do? I kind of get a little aggressive and ask the person not to talk to me that way. Because if my child feels like they're being put down, they get anxiety, they get nervous, like what are the things we can do or just ask for a supervisor? Because I feel like it makes the situation worse and it makes my trauma worse. And like the baby is not like your blood is boiling because they're not number one being kind, they're not listening to you, and you're in a high intensity situation. Like I've been in that MRI that's not sedated and gone into the tube. Well, you know what I mean?
Yeah.
So what tips would you offer or things that you can do like asking for a supervisor? Because I just feel like if you don't say something, then it's gonna happen to another child.
Yeah.
And their family may not be comfortable and it may cause lifelong.
So I think the first thing you just said is be aware of what it brings up in you. Like that this is triggering for you, which is great. That's the first part, being aware of that. The second thing I would say is, I don't know if any of you have noticed, but medical providers sometimes model how you're speaking. And so if you're talking to your child calmly, kindly, in a grounded way, they might model that tone. So that's a great thing to do in the moment. They might be getting spun up, but if you can kind of keep down and calm, that's helpful. And then, ask to speak to a supervisor. I tell people to say all the time, this isn't trauma-informed. What, do you have trauma-informed policies? I don't feel like I'm being treated or my child's being treated in a trauma-informed way. I just wanted you to be aware. I've done that before. It's important. Now, whether or not the hospital actually has those policies written that they can refer back to, I don't know, but it's a big buzzword that's coming up in medical settings. I know at our local hospital, trauma-informed is actually something that they it's part of performance evals. So it's starting, it's slow, but it's starting. So use that buzzword and report it, because they're never gonna change unless they know that it's an issue. And again, you're speaking up for other families, which is fabulous, because you can assume if you're being talked to that way, that's probably how the person talks to multiple different people as well. Go ahead.
I haven't heard of somatic therapy.
Someone recommended my son. They actually were kind of neurological trauma and so what? And they thought that might help with it. And I know nothing about it.
It's great to try. It has evidence behind it a little bit less, but just because it hasn't been around as often. So it has to do with how you're feeling. So somatic is about your physical sensation. So it's definitely something to try if it's been recommended. Again, some of these therapies don't work for you. Try a different one. There's lots of different ones to choose from. And so definitely, especially with kids who are neurodivergent, it's supposed to be really great. So yeah, try it out. Go ahead.
I was curious also about involving music therapy. That was something that when my son was in hospital, both various the EEG since the attempt to heal, the surgery, all that stuff, where in hospital they had music therapists come around, and that was incredibly helpful in terms of calming him, he was agitated, and then also entertaining him, or
Yeah, there is quite a bit of research actually around music therapy. There's some with kids. I'm actually more familiar with research with like older adults who've had stroke and things like that and who are in rehab centers really benefit from it. I think that's great that it's offered. In terms of like a regular offering, I don't particularly know of any resource that does music therapy, but I would reach out to the hospital or the rehab center that you were at and ask, because they might know, the music therapist there might have a recommendation of someone, if you were local or not, in your community, who might be able to do that. But that's great. It's really good for kids. Art therapy too can be excellent.
One of the struggles I have with my son is that he has an intellectual disability, and I've been trying to get him adequate therapy. I think we struggle with how much he understands and how much he can participate in the therapy. So could you spend a couple minutes talking about some strategies around that?
Yeah, sure. Thank you for asking that. There's this common misconception that some kids are either too young or might not have the capacity to participate in therapy, and that's not true. If you find a good therapist, there are many, many, many interventions that you can use with kids. Kids who are nonverbal, for sure. It might look a little different. It might look more like play therapy. But a skilled play therapist can still get at can assess for those trauma responses that I talked about. Even in nonverbal kids, you can still have trauma responses. They might look a little different. But a skilled therapist can assess for all that and treat it effectively, for sure. So I would encourage you to try to find a therapist who has experience in working with nonverbal kids and pursue that for sure, because it can help. And I'm happy too. My email is here. Email me, reach out. I have parents all the time, say, hey, this therapist takes my insurance and I'm not sure about them. Can you take a look? And I'll take a look and let you know what I think. Or if you have questions about type of therapy or anything like that, please reach out. I'm more than happy. Thank you. And take a handout and I'll post it on the